A few more concepts before we go into the details of peritoneal dialysis. Number one is the idea of osmosis. Osmosis is the movement of water across a membrane. In this case, it would be the peritoneal membrane, from areas of low solute concentration to areas of high solute concentration. So if you can see this diagram, you can see that the water molecules are moving towards the area where there is a lot more sugar molecules because there is a higher solute concentration. The second concept for peritoneal dialysis is something called diffusion. Diffusion is the movement of molecules across, again, a membrane, and again, in this case, the peritoneal membrane, from areas of high concentration to areas of low concentration. So these molecules such as electrolytes, sodium, potassium, creatinine, albumin, urea, also medications and even toxins. If you will see from the diagram, you can notice that the molecules that have higher concentration will move over to the areas where there's lower concentration. Another concept is called ultrafiltration. This is a very important concept. This is how much water you want to remove. And ultrafiltration is calculated by volume removed minus fill volume. For example, if your fill volume is 100 milliliters and the amount you removed is 150 milliliters, then the ultrafiltration is 150 milliliters minus 100 milliliters. And so you've actually removed a net negative of 50 mLs. It's very important when you do peritoneal dialysis that you establish accurate tables to log these volumes, because you all have different volumes to fill and drain. What you really want to measure is the net removal of fluid. Some factors affecting ultrafiltration. Dextrose is what we use to pull the water out because of the concept of osmosis. So higher dextrose concentration will allow for more water removal. If you increase the dwell time, the amount of time the fluid is in the peritoneal cavity, that will also allow for more water removal. Finally, if you increase the fill volume, the amount of fluid you put into the peritoneal cavity, that will also allow for larger water removal or increased ultrafiltration. If you want to decrease ultrafiltration, so if you're removing too much fluid too quickly and you're worried about hemodynamic instability, then you can decrease the dextrose concentration, decrease the fill time, and decrease the dwell time.